Well, right, and this issue of prevention versus treatment, you know, obesity, as you know, we've been talking about this for a really long time. It's a very complex problem, and I hate to be a downer, but why have any kind of optimism that we can make a dent in this? We see the obesity rates seemingly getting worse and worse every year, including after the pandemic.
Yeah, so a lot of times it just takes greater public awareness for people to be able to recognize this long-term cost on our society. With obesity may come sick days, days you can't go to work, all these types of things. And so, the country has to recognize it. The medical community has long recognized it, but sometimes we've been tied up. And so, how do we work with the FDA to get drugs approved that can help patients with obesity and work with several aspects of the condition itself? And so sometimes it's a matter of what Medicare approves, and as Medicare goes, so goes the others. So we do have a bill, as you were aware, and I'm the Republican lead, and it's called the Treat and Reduce Obesity Act, and it's a bipartisan bill. It's with me, Representative Ruiz, as well as Representative Kind and Reed. Well, in this, you have two Republicans, two Democrats, and you have two physicians, one on each side of the aisle. So currently, FDA-approved medication for chronic weight management are not covered by Medicare Part D. So the bill that we have would require Medicare Part D to cover at least two anti-obesity drugs. And that would go a long way. And again, as I'm talking about access to types of treatments, access to care. And another problem that we see is Medicare currently reimburses physicians, certified nurse specialists, physician's assistants for intense behavioral therapy related to patients with obesity. And they're the only ones covered. But what this bill does is also allow other treatments, if you will, if a physician refers a patient to a clinical psychologist, for example, or a registered dietitian or a nutrition professional. All of these things, all these specialties, they're part of the team in treating obesity. So this bill would expand that and allow us to get a more broader range of care available to patients. And as I said, as Medicare goes, so goes the other healthcare coverages.